Hey everybody, welcome to the answer session of Ask Dr. Dan. This week we were talking about platelet-rich plasma, or PRP, for hair restoration. This is an all-natural way using your own cells to help stimulate hair growth in areas where your hair started to thin. So let's get to the questions. The first question is, how many treatments are needed? So that is very variable from person to person. The way I do things is I like to do the least amount that works. So for some people, you will get very good hair growth even after one treatment. And some people, it may take 3, 4, or even more. I will say that women tend to grow hair much easier and faster. So women tend to take less treatments. Many times one treatment is enough. Where for men, it's usually a little bit more stubborn and will require more treatments. But if that hair is growing, we let it grow, and we kind of see what we get. So that number is very variable from person to person. The second question is, how often do you do a treatment? So there is no hard and fast rule for this. If you talk to certain people, they'll give you different answers. What I like to do is wait at least about 10 to 12 weeks between treatments, because I want to see how much growth is happening. And if the growth is really good, then we will just basically watch it. If it needs a little boost, then we'll talk about another treatment. After the second treatment, again, I wait that same amount of time to kind of see how it's doing. So that's the way I usually do it, again, because I want to do the least amount that works. All right, so the third question is, how much does it hurt? So it's not very uncomfortable. It is a lot of needles in the scalp, and then we also do some microneedling. But what we do before all of that is we use a topical anesthetic. So we basically spray that anesthetic in the areas that we're going to be treating, and we let that sit for about a half an hour. So by the time we're ready to do the procedure, it's not very uncomfortable at all. Sometimes you get a little bit of a pinch, but really nothing too bad. Also, if there is something that is required, we can do a block of the scalp, but we really don't need to do that very often. The next question is, does it work on everyone? So the answer is there are certain types of hair loss that this will not typically work on. So when we evaluate the scalp, if it looks like there is scarring in the scalp, a lot of times you won't get hair regrowth from that. That's usually from conditions, things like lupus or actual injury to the scalp, burns or something like that, where the hair follicle is actually killed and you can't bring it back. But also there's a type of alopecia where it's global loss of hair all over the body, and a lot of times that will not return even with the PRP. But for your most typical types of hair loss, which is most of them 95% plus, you will get a good response. And that being said, though, nothing is 100% for everything in anything that we do. So there are some people that don't respond quite as well as others. The next question, is this permanent? And the answer is yes. So this is a permanent form of hair restoration. That being said, like we talked about in the first part of this week, was that you have to test other things like your hormones and your vitamin levels and your thyroid, because if you're fighting those things, if you have a thyroid issue or your vitamin D is low, you might get some hair regrowth and then it might fall out. Or you might get hair regrowth, and if you're still having a lot of stress, you might lose it again. So you have to address all of these issues as well, which is very important. But if all those issues are addressed and we're getting good hair growth, it is a permanent form of hair growth. And last is, can you combine this with laser? And the answer is yes. So they've actually shown that red light laser actually does help with hair regrowth. Some people do it as a standalone treatment, but it requires a really, really long time, and you have to keep that on for a very long time. We have a high dose laser in our office, and what we do is we lower those settings a little bit, and we found that in combination with the PRP will really show quite a bit of hair growth. So that's all the questions for this week. I hope you all have a great week. I hope you have a great Halloween, and we'll see you next week. Remember, don't operate, regenerate.